first, I'll say it gives me so much pleasure to see everyone here in person. I know it's been a difficult few years with a lot that we've had to do virtually. And I know that we've become so much stronger at figuring out how to stay connected, how to keep our programs moving, how to still see results, even as we have to engage virtually. But today, it's reminded me how important it is for us to connect in person. And thank you everyone for taking the time to spend time with us today to hear from each other and to learn from each other. So a little bit about who inSupply is. We're a very new organization. We are an East African organization. We're headquartered in Nairobi. We have an office in Tanzania. And every single one of us on the team is from the countries we're in. So I'm Kenyan. The whole team here is Kenyan. The Tanzania team is led by a Tanzania. And that is deliberate. That is part of who we are. We believe in locally led, contextualized solutions. We're affiliated with JSI. I think some of you may have heard of JSI, John Snow Inc. inSupply is only 2 years old. So often we started as JSI as we were transitioning. And so sometimes you may be a bit confused. We're still one family. We work together very closely. Some of the ways in which we work is a little bit different. And so I just wanted to clear up that confusion. One of the things, I'm sharing our mission and our vision because we're new, and also because to share exactly what we do that is different. So we co-create, and we're very committed to both innovation and sustainability. That's not two words you often hear together, but for us, those two go hand in hand. Innovation is how we keep moving forward, but sustainability has to be part of it. As Dr. Salim said, we can't start something without thinking about how it's going to keep going after we go. So some of the things that inSupply does differently, as I mentioned, we are able to benefit from the JSI relationship, and we have that global perspective. We also believe in supply chains in particular, the process is super important. For many years, supply chains have focused on one output, stock out rates. And that's a really important output, because that decides whether or not people are able to, as I was talking to my colleague from Transoya and even from Siaya, if community health volunteers don't have products, they lose trust of the community. We've invested in service delivery. We've invested in so many things. And when the commodity falls short, then all that investment is lost. But the problem with building a strong supply chain, you can't focus only on one outcome. You have to understand the whole system and invest in the whole system. So we believe a lot in investing in processes and the system. And finally, our signature approach is to really put people, process, and data at the center of our solutions. We are secretly inside, we're a bunch of data nerds. We love data. We really look at data to help us answer the problems. But we also use data to not only quantitative data, but we use data from our users. We listen to them, we hear their voices. Because fundamentally, supply chains are implemented by people. And ensuring that those people have the right capacity and are motivated is more important than anything else. So we bring all these things together. This is a little bit about some of the clients and partners we've worked with. We've been very privileged to be a partner with the government in Kenya at the national and the county levels, and for many years. So you will see the 9 counties in this room, and we value and treasure that relationship. We've also worked with a total of 17 in Kenya. And so we believe very much that change will happen at the subnational level, and that they're the ones who are going to lead us into the future. And the projects that we'll hear about today, we've had the privilege of partnering with 9 counties. We work with 43 impact teams, which are cover 53 sub-counties. So not every sub-county has its own impact team. In some places, especially, for example, Nairobi, in Mombasa, some of the sub-counties come together and have a joint impact team. And we have worked with 281 community health assistants and over 3,500 CHVs, community health volunteers. They are our frontline workers, and they're the ones who we really miss today, but who are represented here in the work they do and in their spirit. So the first project I'll talk about very briefly is called Data Use, and that's where the impact teams have really grown and evolved. The slide is very, very busy, and that was done deliberately because data use has many components to it. There is, for those of you who have been through the data use and impact team approach, you'll recognize our blue signature circle. It's the innovate, do, review cycle that impact teams are based on, the traditional quality improvement approach that has evolved with input from all the counties that we work with. Just next to the blue circle, you'll see a little dashboard. Many of you saw it at the solution table outside. That is the ITT, the indicator tracking tool. And that is your own data that we present back in the form of a Power BI dashboard. So that's KHIS data that listening to the voices of the counties, they have said, this is what will help us make our decisions. This is what will help us use our data. And that ITT is the same data that everyone has access to, but presented in a way that lends itself to supply chain decision making. Below that, you see, we might rename some of these personalities, but this is part of our human-centered design approach. This evolved from the first iteration of impact teams, where we realized that there was a capacity gap, but that the capacity gap was not one that we wanted to fill with traditional classroom training. That's where we developed a user-focused, self-paced capacity-building approach. You can use a phone. You can decide which persona you are and basically learn that skill on your own time. So I was having a discussion this morning. One of our key personas is called Organizing Otto, as many of you know. And they were like, why didn't you call him Onyango? Right? That would have been more local. And we wanted to acknowledge that maybe Onyango is not a relevant name in Tanzania, but maybe we can use some Swahili like Omari, so I think we might go through a rebrand with some of these personas and make them our personas. And then lastly, you'll see this, last but not least, you'll see the last dashboard in the corner. And this was work we did around trying to improve data use for cold chain equipment remote temperature monitoring. Mr. Some has been such a great partner of ours on this. And this is like one of those forgotten children, right? The cold chain remote temperature monitoring keeps our vaccines cold. We know how important that became during COVID. And so the focus here was using human-centered design to basically understand, how do we make that data usable? How do we make it easy for technicians to understand what's going wrong and to take action? And the same with the EPI logisticians. And again, you'll hear about that later. A very quick overview of how the impact team approach has evolved. I just want to again underline, it started out in 2016 and 2018. Dr. Hanif was one of our first implementers of the impact team approach in Mombasa, and it was very much focused at the county level. And through iterations and through listening to him and others who implemented it, we evolved the approach. It now works at the sub-county level. That's the operational level. That's the level that works really well to problem solve, troubleshoot, take action. And we've seen really amazing results with some of these impact teams. If you look at the family planning data, the immunization data, we've got increased reporting rates compared to non-impact team sites. We've got better inventory management, fewer stockouts. So this approach works, and it works because the counties themselves have given us the feedback and shown us what's the best way to make it sustainable, what's the best way to embed this, and what's the best way the data can work when it serves their purpose. Scale is the second project that you'll hear about today. And again, you'll see human-centered design come up. When we first started, Siaya was one of our first counties with C-Stock. And we implemented as a pilot in Bondo and Ugunja. And after that, it became very clear that this was a solution that could work, that could inspire confidence for community health volunteers to manage commodities. But it needed to be adapted to all parts of Kenya. Dr. Salim was one of the first leaders we spoke to, and he actually launched the idea of C-Stock in Kenya. And he said to us, C-Stock has got to work everywhere. It can't just work in those counties that have resources, that have connectivity. It's got to work, and it's got to unify the whole country. So we took up that challenge, and we used human-centered design and started working in some of the hard-to-reach areas where we have nomadic communities. We may have different education and literacy levels. And we made sure that C-Stock could be used by every CHV in the country, not just those ones that have Android phones. And so that's another success story you'll hear about today, and we're really excited about that. The other work, so in scale, you'll see C-stock, which is a source of data at the end of the supply chain. You'll see impact teams again. They were adjusted for these different settings. And the other thing you'll hear about is an approach we used called development evaluation. It's a utilization-focused M&E approach. And basically what that means is we don't wait until the end of the project to measure impact and see how we did. We try and do that continuously. And it's a very participatory approach. It's not for us to tell you this is how we're doing. It's for us to come together and say, what is the data saying to us? Let's all make sense of it. And all of you have participated in our DE approach. And that has been something that we're very proud of, is being leaders in how evaluation needs to change in complex settings and with complicated systems that are dynamic. So here are some of the scale milestones. We started in November 2018. Obviously, when COVID came, it was literally the week we were supposed to start C-stock rollout. So we had a little bit of a bump, but we actually, together with our partners and our county partners, we took a virtual approach to begin with, and then we transitioned to physical. And since then, once the rollout was complete, we've really focused on institutionalization, continuous monitoring, and understanding how do we strengthen that system. And that's where the DE came in. We'd hear from the CHVs, we'd hear from the sub-counties, and adjust our approach to make it work. So just as I've mentioned, we've tried to partner with the ministry, the national, the county, the sub-county governments at all stages. In design and co-creation, the impact teams, we deliberately formed human-centered design teams and went out and heard from everyone. How can we improve impact team design? How can we, with development evaluation, we've had sense-making meetings at national and at county levels that bring in the perspectives and that help us interpret the data in a way that can be usable. And then with our TOTs, we've established national teams, TOT teams, county TOT teams, sub-county, and even SHA TOTs, so that when we go, there's no capacity gap. The system can continue to roll out. There are champions within the ministry, and all of this does not depend on inSupply. And finally, we looked at how do we break down sustainability. Integration is a really important component. And as Dr. Salim said, one of the milestones we're very proud about is integrating C-stock within KHIS under the leadership of the ministry at different levels. And of course, integrating impact teams into the different fora at the county and sub-county levels. So we used an approach called outcome harvesting. Again, it might sound new. The concept is similar to DE. It is an approach that works really well in complex settings and when there's a lot of change. So not only in the ASAL counties, which are very complicated to work in because they experience so many natural disasters, climate change, so many things, but also COVID has affected all of us. If we tried to use traditional evaluation approaches at the start, probably it wouldn't be very helpful for us in terms of lessons learned and moving forward. So outcome harvesting looks at unintended and intended outcomes. And what we do is we use a very participatory approach. So we pulled together many of you or your colleagues as substantiators. And they sat down with the outcomes and they decided, do these make sense? Do we agree with them? How might we change them? And the finding was that most substantiators fully agreed with the outcomes. None of them disagreed. They gave really valuable input. So the original outcomes changed through their participation. And so we harvested 19 total outcomes across scale and data use. Some of the examples are here. For example, impact teams provide a structured, resilient, and flexible way to review data to inform decision making. And this came from across the counties, all the 9 counties. And if you know Kenya, which of course all of us do, many of these 9 counties are in very different circumstances, but all of them found ways to make impact teams work and make decision making better. The second finding or outcome that we want to highlight is that C-stock is an effective way to bring services to underserved populations. And that was our goal. So we felt very good about that goal. You can see there's other outcomes. These 19 are spread out and we categorize them. So several approaches for sustainability and ownership emerged around the IT approach. One of the other outcomes was a standardized community health commodity reporting tool. And as I said, integration of C-stock data and KHIS. That means every KHIS user who has a login can access that data. It is not dependent on inSupply. Improved commodity management practices. One of the things I feel really great about is that when we first started, there was a lot of hesitation about whether community health volunteers could be trusted to manage commodities, right? They're volunteers, many, especially in different areas, may not have high literacy. How could we trust our valuable commodities with them? Because of C-stock and because the community health volunteers themselves use C-stock and understand it, there has been a change in county leadership deciding, you know what, we see the data, we can trust them, we're going to start buying commodities. And if we want to achieve UHC goals, that's such an important goal for us, to make sure that we can equip CHVs with the right tools they need to be successful. And then finally, as I mentioned, improved data visibility. We all heard the beautiful data slogans today. We know how important data is for supply chains, and both the ITT and C-stock improve data visibility across different commodity categories. So with that, I'm going to hand it back to Judy just to say that, again, today we're going to have 4 panels. And the panels will directly share their achievements, their lessons, their challenges, and their plans for sustainability. So we deliberately designed the panel so that you can hear the voices of the county. And the counties will not present everything they've done. As Judy said, they're going to take 5 minutes. They're going to focus on one area that they wanted to showcase, for example. One county might focus on impact teams, another on C-stock, another on DE. They will share the snapshot of what they have learned over the years, and you will hear from them and have the chance to ask them questions about how it's gone. And then once we have these 2 data spotlight projects, we'll move into 2 panels on sustainability. And that will be a seated panel with members of the county where we can all hear from them on their plans for sustainability and also ask questions so that we can learn from each other. The goal for today is to learn from each other so that we can help improve ourselves, but also scale up what works. So thank you very much, and really excited to have a great day today.